Hi, I'm Dr. Al Story. I'm based out of University College Hospital London, and I run a pan-London outreach team called Find and Treat. This is a unique service. We screen almost 8,000 people a year who are on the street, and they're at great risk of tuberculosis. TB is a disease that has really shifted from the general population to be very concentrated now in specific risk groups. And unfortunately in London we still find very high rates of TB amongst homeless people, hence the need for active case finding with mobile radiology. We've been doing active case finding using a digital X-ray unit since 2005, and in that time we've collected over 100,000 images of people who are on the street, accessing day centres, drug treatment services, etc. And we find a very high detection rate for active TB, but we also find a very high burden of other significant pathologies that would warrant medical investigation and attention. This data set's unique. It's a huge image library that would provide someone with a wonderful opportunity to explore the application of machine learning, AI, to actually find out, what's hidden in these images, and can we use this technology to make the predictive value of the image better and enhance perhaps the radiographer's ability to make an appropriate referral on the spot. I'm now going to hand over to my colleague Paul Taylor from UCL Institute of Health Informatics.
My name is Paul Taylor. I'm a reader in Health Informatics here at the Institute of Health Informatics at UCL, and I'm interested in the application of medical image processing to a range of problems in medical imaging, particularly ones where we're combining the imaging data with other data from the hospital record. The project with Find and Treat is really exciting for two reasons. One is we've got a really large data set of images, which is quite unique, both in terms of the size of the data set and the population that we have access to. One of the things we're going to be doing in this project is applying a novel kind of machine learning, something called Generative Adversarial networks. And these are a really interesting form of neural network which combine two networks, one of which generates data from a model of the data set that we're interested in, and one of which attempts to discriminate between the synthesized data and the real data. And by putting these two in combination, you can learn a very good model of the underlying information in a data set. And one of the things that I think is particularly exciting about applying this approach to this data is you can use a generative adversarial network to learn a model of normal appearance. And one of the things which we've struggled with applying machine learning to data sets like this is you very often have thousands, tens of thousands, even hundreds of thousands of normal cases, but you don't have a matching number of disease cases. And the great thing the great promise of the generative adversarial network approach is that we could learn a model of normality from the huge numbers of normals, and then that would give us information which we could use to identify the smaller number of abnormal cases. And what's really exciting at the moment with the Find and Treat dataset is that we've been able to access the NHS number for these individuals, so we can link their image to other information that the NHS knows about them. So we can then look and see whether there are perhaps signs on the image, independently of TB, which might relate to other diseases which these patients are at risk of, such as heart disease or other forms of pathology. So UCL is a fantastic place to do this kind of research. So here at the Institute of Health Informatics, we specialize in data-intensive medical research. So we've got a lot of experience in using very large data sets, in using linked data sets which combine information from healthcare records with other forms of data. And what's fantastic at UCL is that we've not only got this, but we've also got a world-leading computer science department that's one of the best departments in the UK for artificial intelligence and machine learning.